Hello, folks. Welcome to week 4 and our second helping of legal and ethical issues. Last week, we focused mainly on the legal side of things. This week, we're going to finish up with that by having a little bit of more information on informed consent and advanced directives, and then we'll dive in and talk about ethical issues in surgical technology. So last week, I included on the PowerPoint and the video the objectives for this unit relating to legal, and this week, since we're focusing more on ethical and moral issues, this slide lists the objectives for ethical and moral issues. So take a moment now, pause the video, read through these objectives to help you anticipate the rest of your learning in this unit. So what does it mean to give consent? To consent is to give permission for an action, or more specifically, as your book states, consent is a voluntary and informed act in which one party gives permission to another party to touch. Notice that this description contained the word informed. Almost all surgical patients have given written informed consent before surgery takes place. So, what is informed consent? It means that before surgery, or before someone can give consent, they're made aware of the nature and the risks of this procedure that they're consenting for. The doctrine of informed consent says that the patient has the right to know and to understand. So it is written consent that is signed before surgery. It has to be signed before the patient enters surgery or the treatment area, and it can't be signed under coercion or intimidation. And the information must be presented to the patient in a language that they understand. The procedure and any potential risks or complications to the procedure must be explained. And finally, the patient needs to be made aware of any alternative options and the risks and benefits of those options. So some items that absolutely must be included on the written consent are the patient's legal name, the surgeon's name, the procedure to be performed, the risks involved with anesthesia and also with the procedure itself, the legal signatures of both the patient and the witness, and the date and time of those procedures. So that's 7 vital things that need to be included on a written informed consent. So in addition to these 7 things, they may also include consent to allow the surgeon to bring in colleagues to assist them if needed. So the next question we should be asking is, who can sign an informed consent form? A competent adult can sign a consent form for himself or herself. A parent or legal guardian can sign for a minor. The interesting thing here is a patient who's also a minor can sign the informed consent form for their own child, but they may not sign it for themselves because they are minors. So a minor can give informed consent if he or she is emancipated or married, and a guardian in place due to physical inability of the patient or legal incompetence may also sign the consent form. So this may be a permanent guardianship or temporary. A hospital administrator can give informed consent for another person, and so can a court. To give informed consent, a person cannot be under the influence of drugs or alcohol. So what happens if they are? Right? Imagine a gentleman who falls down a flight of stairs celebrating his daughter's wedding. He broke his hip, he needs an emergency surgery to fix it, but he'd consumed 2 beers with dinner. In an urgent case like this one, his spouse or another responsible adult relative could sign the consent form. Illiterate patients can sign their consent forms with an X, and in this case, the person acting as a witness will write patient mark next to it. Surgical techs may not act as witness, neither can the operating surgeon. So usually this role is filled by an RN. Consent can be either express consent or implied consent. Express consent is a direct verbal or written statement granting permission for treatment. Informed consent is a type of express consent. It's preferred in healthcare over implied consent, which is when circumstances exist that would lead the healthcare provider to believe that the person or patient had given consent even though no expressed words of consent were given. So that definition can be found on page 31 of your book. An example would be the surgeon finding more extensive pathology than originally planned and having to do a more invasive procedure. If the family can't be contacted, implied consent will be assumed. Okay, let's move on from consent now and spend a moment talking about advance directives. Advance directives give directions about the patient's wishes when it comes to medical treatment. In the advance directives, you may find a living will. This document makes your wishes known regarding life-prolonging treatment. It will outline what measures you want taken. This is a document that is filed but does not take effect until you're incapacitated. So advance directives may also include a healthcare power of attorney. This is a legal document that gives another person the right to make medical, not financial, decisions for you if you are incapacitated. This person needs to be made well aware of your wishes before they're needed in this capacity. You do not want to put a loved one in the position of making these difficult medical decisions for you without knowing if they're following your true wishes. Also found in advanced directives will be directions for organ donation. It's not always a simple yes or no. An organ donor can specify what they want to donate. Occasionally, the advanced directives will include a refusal of tissue or blood products. And this is usually because of religious reasons. For example, Jehovah's Witnesses do not accept blood products. You should know that depending on the procedure, this may be something that can increase the stress level of a procedure room. DNR stands for Do Not Resuscitate. If a patient has a DNR in their advanced directives, they will not be resuscitated in the event of a cardiopulmonary arrest. However, DNR orders are typically suspended in the OR. Surgery is a special circumstance, and DNR orders do not apply. The DNR then is reinstated in the post-operative unit. Let's move along from our legal discussion and get into the ethical portion of this unit. We'll start by talking about the American Hospital Association. The American Hospital Association was founded in 1898. They represent almost 5,000 hospitals, healthcare systems, networks, and other providers, and 43,000 individual members. They provide education and information to help hospitals stay current on healthcare issues and trends, and the education they offer includes a lot of administrative topics in order to help hospitals run better. So we're looking at things like policy management, criminal background screening, patient flow, business models, and things like that. The vision of the AHA, or American Hospital Association, is of a society of healthy communities where all individuals reach their highest potential for health. Their mission is to advance the health of individuals and communities. The AHA leads, represents, and serves hospitals, health systems, and other related organizations that are accountable to the community and committed to health improvement. They want to improve the health of all people. The AHA advocates for patients and their rights in the hospital. They developed a set of guidelines to help patients understand those rights. It's called the AHA Patient Care Partnership. It used to be called the Patient's Bill of Rights. So this empowers patients to know their rights and also to be sure that their physician has what they need to give the highest standard of care. So if you take a look at this slide, if you open up the PowerPoint file rather than the video, the links on this slide lead to a PDF file of the AHA Patient Care Partnership. So moving on now into some ethical terminology. Tenets are opinions, beliefs, or principles that are held to be true by a person, and especially by an organization or religion. A great example would be the Jehovah's Witnesses we talked about a little bit earlier. They do not accept blood products because it goes against their spiritual beliefs. Another example would be vegetarians choosing to abstain from eating meat. The AHA Patient Care Partnership is held to be true by the AHA as well as by the 5,000 hospitals that they represent. The Surgical Tech Code of Ethics is a set of principles held to be true by a group of people known as the AST and its membership. So what are some of the elements that go into ethical decision making? The things that influence our ethical decisions. So, personal values can also be called personal tenets, opinions, principles, or beliefs that we hold to be true. Ethical principles is something we'll talk about next. Accountability, which we talked about a bit last week, this is about being responsible for your actions. Just remember, responsibility is the role, accountability is the action. Religious and cultural beliefs. Morality, which is strongly tied to ethics. Morality is what's right and wrong versus ethics, which is more like what's best for humanity. Moral dilemmas are when you need to make a decision, but you're conflicted because there's no really right answer. Corporate integrity is staying along the guidelines which are set by the hospital. And finally, problem solving. So one of the elements of ethical decision making was ethical principles. So let's explore those here. To respect human individuality and uniqueness. So no matter how different a person is, they're still human and they deserve the best care that we can give them. In our personal lives, we can choose who we surround ourselves with, who we spend time with. But in the OR, personal differences have got to go away. People will come through your OR as patients. Maybe they have terrible racist tattoos. You'll see drug addicts, alcoholics, prisoners. It doesn't matter who they are, what their story is. They still deserve the very best of care. Do no harm speaks for itself, and it was one of our principles from the legal portion of this lesson. Beneficence is empathy and a commitment to healing. So move beyond being uncomfortable with the patient and focus on just giving them great health care. Acting with justice in the OR refers to the patients having the right to equal care regardless of age, race, and socioeconomic status. To respect the confidences entrusted to you. This refers to both the patient confidentiality and those around you. So gossiping in the OR is not acceptable. The staff that works together in an OR becomes a kind of family. Respect and trust is very, very important in that relationship. The staff that respects each other are going to be able to create the safest environment for the patient. Act with faithfulness. Honor the patient's trust in you. Those of you that have been patients in the past will understand the amount of trust that you place in the OR staff. Imagine willingly rolling into a cold OR, naked under a hospital gown, oftentimes not wearing your eyeglasses, your wedding rings, your dentures, and going to sleep, trusting that the staff in that OR will take care of you and keep you safe. Not only to perform a successful procedure, but to keep you warm, to protect your dignity as well as possible, to treat and speak about you with respect, and to do their job with as much effort as if it was their own family member on the OR bed. I just saw, the other day, I just saw them open up a pan, and the person who checked the wrapper that was around the pan stopped the tech and said, "No, don't put it on your table." And she held it up, and there was a little tiny little hole coming through the drape, which contaminates the pan that the tech was about to put on her table. And she said, "No, don't put that on there. Look, there's a hole." And the tech said, "Oh, no." And the person who had opened the pan, she said, "Yep, I wouldn't use it on my mom." And that's a perfect example of this. Act with faithfulness. It's a huge loss of control for the patient and an incredible amount of trust, so we need to honor that. Never allow yourself to forget that each patient is a person, and to that person, there's no such thing as a minor procedure. To them, it's always a huge deal. So do your job and trust your skills and those around you. And trusting those around you, this is called autonomy. Act with honesty. Never, ever hide a mistake. We all make mistakes. What matters is that you own those mistakes and you fix them. If you're unsure of something, you've got to ask for help or for clarification. Respect the free will of the patient. Your patients have the right to refuse care and to make decisions regarding their care. I've been in on a case where the patient, for religious reasons, wanted the OR to be as silent as possible through the entire time he was there. Even when the patient was under anesthesia, everyone stayed very, very quiet, whispering if they needed to communicate, communicating as well as they could beforehand, so that they would need to talk as little as possible during the procedure. I've seen a patient roll into the room and then change their mind and ask to be taken right back out again. The patient's welfare has priority over everything. You have a duty of care to always act in favor of the patient and their welfare. This may even mean that you report a team member if needed. So, we've talked a lot about the rights of the patient. Let's talk about your rights as an employee. You have the right to abstain from participating or to refuse a task that violates your ethical, moral, or religious values. This doesn't mean you can look at the schedule in the morning when you get to work and say, nope, I think I'm going to abstain from participating today. You must let them know immediately upon hire or even at the interview. Be clear about exactly what you are choosing to abstain from. If an incident comes up and you have to refuse the case on the spot, be sure it is well documented. If you feel like you cannot work with one of your coworkers based on inappropriate behavior or abuse, it has to be documented with your supervisor ahead of time before a case comes up. If you leave or ask to leave during a case, it could be considered abandonment. Surgical conscience is the core of your integrity as a surgical technologist. The surgical conscience is built upon several concepts. Commitment to cost containment. Healthcare is expensive. Wasting supplies in the OR adds to the problem of the rising cost of healthcare. So, if you have something on your setup that's expensive and you may or may not be using it, it would be a good idea to wait and confirm with the surgeon before you open it and save the cost of that item. Confidentiality. Non-discriminatory treatment of all patients. This one goes right back to the ethical principle of respecting individuality and human uniqueness. Personal moral integrity. This one refers to your right to refuse a task. Principles of asepsis and sterile technique. This is perhaps one of our biggest responsibilities as a surgical tech. We're the last defense for that patient against dirty instruments. We're the people in the room most able to defend the sterile field because we are the ones who helped to create it. So don't be afraid to ask someone to take a step back from the sterile field. It's not hard for an observer to get too close without realizing it. Most OR staff do pretty well being aware of their surroundings, though. Take your cues from them as you start your clinical rotations in this fall. Professional honesty is referring largely to asepsis and sterile technique. So if you see something getting contaminated or you think there might be some bioburden on an instrument, you need to speak up, even if it's the last instrument of its kind in the department, even if it means you might delay the case while something gets reprocessed. Even if it means telling the surgeon he just contaminated his gloves and, hey, here's a fresh pair, let me help you. The discomfort of delaying a case or feeling like you're calling someone out is worth it if it means your patient doesn't have to deal with a preventable infection and a poor outcome. Sterile technique, which we stated before. So this slide outlines some identified barriers to surgical conscience, which we just spoke about in the past slide. None of these are really acceptable excuses. Lack of resources, for example, having only one of a particular set of instruments, and you open it up before your case only to find that, oh no, it's contaminated with bone from the last case. It may be tempting to remove the bone, hide the fact that you noticed anything. After all, no one saw it, right? If you send the tray back to be re-sterilized, it may delay you up to 30 minutes. It doesn't matter. You have to guard your surgical conscience and integrity here. I actually just recently saw this exact situation occur in the OR. And I have to tell you that, especially as a new tech, I think that sometimes we feel intimidated and we feel afraid to speak up when we see things like that. And we absolutely always have to. This is a standard. This is expected of us. This is our job. It's the core of what we do, okay? Is keeping our patients safe. So just like what I saw just recently where, they push a drill through a little guide and poof, a piece of bone flies out the end. It didn't get cleaned well enough, I guess, from the last patient. And in that moment, there's no hesitation. It's contaminated, and the whole team is on board. This is a standard. So they may seem frustrated. They may seem unhappy. But trust me when I tell you that if you identify something like this and you tell the team about it, they're not mad at you. They may be frustrated that their instrumentation isn't clean, and that now they have to do some critical thinking to fix the situation. But please trust me that it is always, always, always better to open those lines of communication and say, whoa, I just saw this contaminated item, or you know what, I think my elbow bumped that light and I need a sleeve. Even if it takes a moment to fix that contamination, it is always better than, potentially harming this patient through contamination and infection. So pure apathy. So maybe your colleagues open up all the expensive hold items because it's easier than asking the surgeon and opening only a few later. Maybe they don't care or don't believe that bioburden is dangerous for the patient, and they don't want to send their contaminated trays back. Doesn't matter. You always, always have to protect your integrity and the integrity of your case, okay? And finally, another barrier is stress. Stress can really affect a person's ability to do their job. It doesn't matter. Stress is a part of life, and we cannot let it affect the quality that we strive to here in this role. So in 1985, the AST put out something called the AST Code of Ethics. This is a professional code of conduct, and breaching these guidelines would likely result in your expulsion from this profession. These are pretty important to you in your future career, so let's read through them now. Okay, so the AST Code of Ethics: to maintain the highest standards of professional conduct and patient care, to hold in confidence with respect to the patient's beliefs all personal matters, to respect and protect the patient's legal and moral rights to quality patient care, to not knowingly cause injury or any injustice to those entrusted to our care, to work with fellow technologists and other professional health groups to promote harmony and unity for better patient care, to follow principles of asepsis, which you're learning now, to maintain a high degree of efficiency through continuing education, to maintain and practice surgical technology willingly with pride and dignity, to report any unethical conduct or practice to the proper authority, and finally, to adhere to the Code of Ethics at all times with all members of the healthcare team. So this slide and the next slide contain a list of possible ethical conflicts in the OR. This is the list that you will be using for your wiki assignment this week. And here's the second half of the list. So thanks for listening to our Week 4 lecture. I look forward to having a really great discussion with you folks, or contribution, I guess, to the wiki assignment this week. It's a little bit different from our normal discussion board, but it usually, I've seen some really great collaboration on the wikis with this ethical conflict topic that we bring up here. So I'm looking really forward to that this week. It's always one of my favorite things, one of my favorite assignments that you all produce, and I hope that you're doing really well and enjoying so far your surgical tech education here at Western. And we'll be seeing you soon. Thanks.